is the cost of having IBS? If you've had IBS or SIBO for a while, you'll know that there are a lot of costs. These might include following special diets like gluten-free or dairy-free, getting private tests to identify the cause of your symptoms, and supplements you may be experimenting with. This episode of the Inside Knowledge, I'm going to cover costs of IBS to the NHS, some typical costs to you, the individual, and also look at the non-financial costs. And I can give you some data I ran from a survey last year about time missed at work. We'll finish up with some of my top cost-saving tips to help you save money. Welcome to episode 92 of the Inside Knowledge podcast for people with IBS. I'm Anna Mapson. Have you ever thought about how much you spend on your supplements, on private testing, on maybe working with nutritionists and even private doctors? A lot of people I work with have spent hundreds, if not thousands of pounds on trying to resolve their symptoms. So I wanted to just do this episode about the potential costs of IBS, and then I'm going to share a couple of cost saving tips at the end of the show that might help you save a bit of money. Because IBS is so common, it's thought somewhere around 10% of the people in the UK will have IBS at some point in their lifetime. The actual spend of the NHS is around £1 to £2 billion annually. Every year, a lot of people are passing through their GPs, then the gastroenterology departments in hospitals, and going for various tests. And all of this is thought to add up to somewhere between £1 and £2 billion. Now, it might be even more than that because not all of them are coded as having IBS, and you only get a diagnosis of IBS once you've been through several tests and several appointments. So some of those earlier appointments may not be included in the overall total cost. When I was researching this episode, I found some information about the kind of costs, and it's quite surprising. Around 1 in 12 GP appointments are actually about digestive issues, and then probably about 60% of these are down to having IBS, so some of them will be down to other conditions as well. So that comes from research, it's quite old, probably about 20 years ago, and actually the costs estimates as well are about 20 years ago, so it may be even more now. But I think what this gives us a picture of is that going to the doctor about your IBS is really common, and because there is a big strain on the NHS, some people feel that they can't get appointments as quick as they like to, and it takes a long time to be referred to see a gastroenterologist, maybe many months you're waiting to even get an appointment, that sometimes people are turning to private healthcare if they can afford it and if they feel comfortable to do so. And so that is an additional cost to go to private doctors, get private scans. However, what we can see with the cost to the NHS already is actually per patient, the costs might be somewhere like £500 to £600 per person per year, but that's made up of appointments with your doctor, investigations and costs associated with all the appointments. So you can see how it would really add up if everybody is getting all of these different tests. I found a bit of data as well on how much each of these different tests costs the NHS, which is quite interesting. Like an appointment with your GP is about £33, with a gastroenterologist like £148, and then there's the tests that they run in the GP surgery like blood tests and stool tests, relatively cheap. But when you go to the gastroscopy, the camera down your throat, or a colonoscopy, then those are somewhere like £500 each per person. And then the test for bile acid malabsorption, the CCAT test, again, that's like another £350, £400. So those kind of investigative tests are normally like the second thing that your doctor would refer you to after you've already investigated the first line of treatments. Part of the reason for some people that it can feel unsatisfactory going back to the doctor again and again is that you only get a short amount of time with your GP. They don't have any nutrition training, and in terms of IBS, they're often just there to rule out other conditions and then diagnose you with IBS. But once you've actually got IBS, there's only a set amount of things that they can continue to recommend. You know, maybe you're going to be recommended antidepressants, maybe some antispasmodics or laxatives, or to try and support you with the symptom management. But people continue to go back and forth to their doctor because they're still not feeling better. And that's because it's really only treating one element of your IBS rather than looking at your whole body. So taking into account your mood, your sleep, your food, everything else, that can be like a more of a holistic way to look at it, because we know that IBS is a disorder of the gut-brain interaction. It's not just about food. It's not just about the fact that you get cramps or you get pain. So I'm not giving you all of these costs in order to try and put you off going to the doctor, because it's really important that you get other things ruled out. Those tests, like a colonoscopy, are really important for looking at inflammation, looking at potentially blockages, growths, things like that inside your body. So really important to get those if your doctor thinks they are relevant. But all of those tests are not relevant for everybody, and that is why a doctor will be best placed to decide. If you decide to see a private GP or a private gastroenterologist, you may be paying anywhere from around £100 for a 15-minute appointment to £300 for half an hour. So that can just be for them to take your case history, to understand where you are, and then make some recommendations. So private healthcare is very expensive, unless you have some health insurance, of course, and then you can access it through there. But for the majority of people, that can be very cost prohibitive. If we look at some of the other maybe non-medical tests that people will often pay for when they have IBS already diagnosed by their doctor, you may be looking online and trying to research various stool tests, SIBO breath tests, and other functional tests. And the cost of these can also really add up, particularly if you're someone who has SIBO, because getting tested is really one of the first things that you need to do before you can treat SIBO. You need to know whether you've got it. So the cost of a private SIBO test is around £165, and that will tell you whether you have got SIBO or not. So that's very helpful. But you only want to take the test and have to pay for the test if it's indicated by your symptoms. So depending on how you're feeling, what other things you've already tried will make the decision as to whether it is an effective use of your money at that point. Other tests that might not be as helpful and can cost a lot more include private stool tests, where you get some analysis back from the good bacteria, the bad bacteria, maybe looking at the health of the gut in general. And I'll probably do another little episode on stool tests in a couple of weeks, just to talk about the benefit to people with IBS. But that can set you back somewhere like £380 roughly for the good ones. The cheap ones generally aren't worth doing, I would say. It'd be a bit of a waste of money. But even then, when you get this data, like, what are you clinically going to be changing? I'm not 100% convinced that everybody who's got digestive issues needs to do these tests. In fact, I think they're a big waste of money for a lot of people. Other tests that you may be tempted to run include a food intolerance test. And again, unfortunately, this is not something that you can rely on to give you information about what you should and shouldn't eat. Listen to episode 75, where I go more in depth about food intolerance testing for IBS, and that gives you loads more information if you're interested to know why I don't recommend IgG food intolerance testing. Another test that you might be tempted to look at is the organic acids test, or OAT, which is around £300. This looks at metabolites in your urine to look at how you are processing key nutrients, and maybe whether there are some metabolites down to fungal infections, that sort of thing. Again, it's not massively based on a lot of good evidence, unfortunately, so I don't run these with my clients. I also have seen a lot of gut health nutritionists or gut health practitioners online saying that everyone they work with needs to have a stool test and a SIBO test, and maybe even an OAT test as well. And that could really be adding up to nearly £1,000. Plus, on top of that, there's their fees. I struggle a little bit with the ethics of this, because they will be making commission on those tests, and it's so not necessary for everybody to go through all of those tests. Other costs to you if you have IBS may be supplements, and again, this is a big area where people spend a lot of money. The most supplements that I've ever seen a client taking when they started working with me was 42 different supplements per day. This was a huge cost, as some of the supplements were very, very expensive. Each of them had been researched and very well understood by my client. However, the cost was racking up to hundreds of pounds, and a lot of people I speak to have spent thousands and thousands on all of these different tests, working with different practitioners, and also supplements. So all of those things really add up. The other financial cost will be things like eating a dairy-free or gluten-free diet, because if you are always looking for particular products that are gluten-free or dairy-free, you will notice that they are smaller than average and cost 2 or 3 times more. Thinking, for example, of bread, you can get a normal loaf of bread pretty cheap, but if you get a gluten-free loaf of bread, it will be half the size and at least twice the cost. So this is something where you can save money eventually when you are able to get off of these diets, because that is something that can really rack up the cost as well. I had a client who was going for dairy-free chocolate, dairy-free ice cream, dairy-free milks, and all of those things. As we could unpeel them and go back to eating a normal diet, she was able to save quite a lot of money on buying all of these special products. So this is another area where it's almost like you've got the financial burden of having to eat in a different way. Now, clearly there are some people who absolutely need it if you've got a dairy allergy or you've got celiac disease. But sometimes people with IBS will go gluten-free, dairy-free as one of the first things they'll do, without really testing out whether the food is a problem or is there another issue that is causing your symptoms. So I really recommend retesting whether dairy and gluten are actually a problem for you. And I'll come on to some other tips in a moment. But I also just thought about some other non-financial costs to having IBS that I recognise in people I work with quite a bit. For example, the cost of missed social events, the cost to your life of things that you want to do but you can't because your symptoms are holding you back. You want to go on holiday but you don't dare to get on an aeroplane or a long train journey. Maybe you want to see your friends but you don't want to eat with other people because the foods that everyone else eats will just be a massive trigger for your symptoms, and so you're avoiding social occasions. So there's a social cost, there's an emotional cost as well of having your symptoms that are untreated or unmanaged. Then also it might not necessarily be costing you money, but it could be costing you your work reputation. If you're constantly having days off work, you're having sick days, maybe just in work you're spending a lot of time in the toilets. Those kind of things can also put a lot of pressure on you, which means you're not operating at your best at work, and so there's an impact on your daily life in terms of the cost of lost time. The place where I see people really losing a lot of time is research into the best diet for IBS, finding out what supplement can support bloating, looking at the costs of different supplements and tests you can get. So there is another element to the cost of lost time in more and more research. Also, like I was mentioning, some of the social or enjoyment costs. So here are a few tips that you might like to implement to help you try and save money on managing the cost in real terms, like actual pounds that you're spending, but also the cost to your missed events that you're not going on, or maybe clothes that don't fit you anymore because you're so bloated. My first tip would be, when you're choosing someone to work with to try and sort your digestion out, is pick someone who only deals with IBS and SIBO or whatever your issues are. Be specific. Work with someone who does this day in, day out. Sometimes people will come to me and say, I saw a nutritionist, but they didn't really specialise in IBS, so they didn't really know what they were doing. Or they ordered all these tests for me, but we didn't really get any information from the test that changed their approach to me, and so I feel like I wasted my money. This often happens when people are not specialists in particular conditions. So be specific with choosing a nutrition professional to work with, whether it's a dietitian, nutritionist, nutritional therapist, whatever, but pick someone who really knows this stuff day in, day out. And of course, if you want to work with me, you can. You get in touch via the link in the show notes. I take people on from all over the world, but this is not a sales pitch. I'm just popping that in there in case this is resonating with you and you think, actually, I would like to work with you. So that's the first thing. Secondly, with your supplements, there are a couple of tips. So one is, I would try to avoid any supplements that have got a lot of different ingredients in, particularly antimicrobial products. If you're someone who's got SIBO and you're trying to kill off the microbes, you know which microbes they are because you've done a test, maybe you've got high hydrogen, for example. You've picked some products that you think are going to kill off these microbes. Well, firstly, you want to make sure that they are in high enough doses. If you want some more tips on dealing with SIBO, then listen to episode 31, where I go through supplements for SIBO, and I've got loads of information in there, and it covers what you can take. But one of the tips I would say is, don't take a product that's just general loads of different herbs in there, because you are unlikely to be able to getting a good enough dose that is tested to kill off the microbes. Then also think about how you can get those ingredients at the cheapest way possible. For example, when you take Fibogel as a laxative, the main ingredient in that is psyllium husk. Now, you can get 10 sachets, and each sachet contains 3.5 grams of psyllium husk. But for a little bit more, you can get 100 grams of psyllium husk that you will take. It's not a brand name, it's just plain old psyllium husk. And of course, it's not flavoured, whereas if you're taking Fibogel, it's got all the flavourings and it makes it a bit easier to drink and so on. But just getting some plain old psyllium husk will last you a lot longer. You can just mix it into water or mix it in something else and drink it down, and then you will be getting a similar kind of dose, but you'll be able to save a bit of money. So thinking about the individual ingredients that you need rather than getting expensive brand names, it's a little bit like the difference between getting a product that's, it's for period pains, but actually it's just ibuprofen. So the ingredients are the same, but they've kind of branded it, something similar to that. So think about how you can just try and get the simple ingredients. Actually, if you are taking hundreds of supplements, probably most of them are unnecessary. It's unlikely that you need quite as many as you think you do. And so whilst there can be a case for supplements really accelerating your progress or potentially adding in nutrients that would be missing from your diet, such as B12 or omega-3 from a vegan diet, often there is no need to be taking lots of things each day. So maybe doing a little supplement audit, looking at what you've been taking for how long and what happens when you stop it, is another way to save money, just by checking for yourself whether you actually need everything that you've got there. Then where possible, you want to try and remove as many dietary restrictions as you can, getting off your dairy-free diet, getting off your gluten-free diet as soon as you can, because that is going to help you to save money on normal products. So the way to do this would be to very gradually and carefully retest a reintroduction. For example, most people who are lactose intolerant can manage some elements of milk in tea, for example, or up to 100 millilitres of milk should be fine, even for people who have lactose intolerance. And so maybe there's a way, if you're not having masses of milk, you can actually just drink normal milk, and you don't need to have lactose-free milk or dairy-free milk, which can be quite expensive. Where possible, see if you can retest some of these foods. And listen to episode 16 about being gluten-free and episode 19 about dairy and IBS, because both of those episodes have got lots of information there about testing and how to get off the diets. The other thing to think about is whether you need all of these expensive private tests. If you're working with a practitioner who is recommending that you take multiple tests in order to identify the potential cause of your symptoms, have a good think yourself about what's been recommended to you. Understand what it is you're actually looking for in this test. Why might you be needing to take it? But also, what else have you done before you need to spend £300-400 on a test? Have they recommended anything that is likely to work? And actually, in reality, have you put that into practice? So whether your practitioner's recommended some stuff, have you actually given it a proper go, and have you followed their advice properly? If you have, and maybe the tests are a good next level test for you, but it's not something that you should jump into before you have started to try and do some of the basics. If you want a reminder of what I consider to be the IBS basics, I've got a free IBS non-food workbook that you can download, and you can find that in the show notes. It's called 5 Strategies for IBS. Sometimes the things that you need to focus on just are the boring basics. You don't need another supplement. You don't need another test. You need to rein it back in and focus on some of these core basics, such as, are you getting enough sleep? Are you doing any exercise? How's your stress levels? Are you doing anything to help yourself feel calmer because of that connection from the gut to the brain? For example, are you eating slowly, carefully, chewing your food? Are you eating a good diet? Like, these are all things that you can check off yourself before you spend any money on other private tests. And I suggest that you try and work through that workbook. If you're trying to navigate all this on your own, do use that as some checklist of things that you can focus on at home on your own. Sometimes the things that actually don't cost much can be very effective. I hope that gives you a few ideas of things that you can focus on and try and save yourself some money, because this is a hard condition to deal with day in, day out. And as we know, there is no cure for IBS, but you can learn to better manage your symptoms. I try to give out information that can help if you are trying to do this on your own, but obviously I can only be generic and give out generalised advice. This isn't a personalised manifesto of things that you should go off and do. But hopefully there's something in this episode that will help you or save you money or just make you feel more confident about your approach to treating your symptoms. So thank you very much for listening to this episode of the Inside Knowledge podcast. Better digestion for everyone.